You're all set, Council President.
Okay. Good afternoon. Welcome, everyone. Thank you for joining us today. Today is February 2nd, and this is a meeting of the Providence City Council as a whole. With that, Mr. Clerk, Madam Clerk, can you please call the roll?
Council President Matos.
Present.
Councilwoman Anthony.
Present.
Councilwoman Castillo.
Present.
Councilman Correa. Councilman Correa is absent. Councilman Espinal.
Present.
Councilman Goncalves.
Present.
Councilwoman Harris. Councilwoman Harris is absent.
Present.
Sorry about that. Councilman Igliozzi.
Present.
Councilor Kerwin.
Present.
Councilwoman LaFortune.
Present.
Councilor Miller.
Present.
Councilman Narducci. Councilman Narducci is absent. Councilwoman Ryan.
Present.
Councilor Salvatore.
Present.
Councilman Taylor. Councilman Taylor is absent. You have 12 present and 3 absent.
Thank you. Madam Clerk, can you please read the first item into the record?
COVID-19 testing vaccination planning with invited guests, including City of Providence Administration, Providence Emergency Management Agency, PEMA, and Rhode Island Department of Health, RIDOH.
Thank you. So thank you to our guests that joined us today for the meeting. Director Hawkins and the team from the response, the vaccine response, thank you so much for being here, as well as some of the members of the vaccine committee, including Dr. Pablo Rodriguez, and also we have Larry Warner also. Thank you for joining us today. And I know this was a meeting that came up together really fast. So really just know that we truly appreciate your making the time to be here with us. The reason why we're having this conversation is because the council, we want to understand the process of the vaccination, what has been the planning that has gone into it. And also, I know we had the first round of vaccine going on over the weekend, and we're trying to understand what is the planning, what was the planning that happened for this weekend? What is the plan moving forward? How we're going to communicate and what we're expecting. With that, I'm just going to turn it over. Director Hawkins, do you want to do an overview first, or do you want me to go to Teresa?
No, I can take it. I have some slides prepared, Council President. Is it appropriate for me to share them, or would you prefer I just voice over them?
Actually, you will have, Sean, can you give her access to share her screen, or would that be
I can
easier?
do that, and I would ask that you please email those to me at your earliest convenience.
Perfect.
Great.
Let me. Could you please try, Ms. Hawkins?
Yeah. You seeing this?
Yes.
Okay. Is that okay? Okay.
Yeah.
So I just wanted to start by thanking you all for having us here, and to say good evening to some familiar faces. Some of you are familiar from when I worked for the city as policy director. My daughter and I were just remembering the number of nights I testified with her in my lap before you. Today, she's running around blowing up balloons, so I apologize in advance for any interfering noise, but you've been patient with me in the past, so I assumed that you would be patient with me again. And in my current role as the Department of Human Services Director, I'm here just as support to RIDO. I've been working with Dr. Alexander Scott and the Department of Health team on the implementation of vaccination. And so they are the experts in this work. I've learned a tremendous amount from them, but have with me today Alicia Mahalikis and Britton Bates from the Department of Health, who will be able to help with any specific questions that you have that I can't answer. I also want to acknowledge Dr. Rodriguez and Larry Werner for all your help. The vaccine subcommittee has been a tremendous asset to our response. There's been a lot of questions and concern about the vaccine and its safety, and the subcommittee has really helped us to determine our path forward, and would invite both of them to jump in at any point if you think my representation of things isn't quite right. So I just wanted to start by providing you, I know that your goal is to understand the efforts of last weekend and moving forward, and I will certainly address those. I did want to just give you a little bit of a foundational overview of how we're designing the vaccine program and what our core principles have been. And then we'll give you some insight into the phasing and what you should expect as it relates to residents in Providence. These guiding principles were developed in concert with the subcommittee. So these are the 4 principles that we consider in all decisions we're making. Obviously, we want to make sure that anything we're doing is safe. This is particularly important as we think about bringing on new vaccines. And so, for example, we expect that we may be considering the use of the Johnson & Johnson vaccine in the coming weeks. The subcommittee really helps us in partnership with the clinicians at the Department of Health to evaluate the research that we receive and make sure that the state is making a decision about the safety of the vaccine, not just kind of rubber stamping what is recommended by the feds. Our goal overall is to minimize morbidity, and you're going to hear me talk a little bit more about this moving forward, but fundamentally, we want to make sure that we're reducing the number of hospitalizations and deaths in the state. And because we're so supply constrained as it relates to vaccine, we have to make some really hard decisions about how we do that. We want to be efficient. So while there's been a lot of work to prioritize and make sure that we're getting vaccine to the right places and people, we also want to move as quickly as possible. We don't want vaccine sitting on shelves. We want to get vaccine in arms as quickly as we can, because we know even after the first dose, people are more protected. And lastly, we want to be sure that we're thinking about access at all times, whether that's related to transportation or other barriers that people may encounter. We want to set up a vaccine distribution system that is accessible to all. The last thing I'll say here is that the team has focused very much on issues of equity. We know that COVID-19 has disproportionately affected, in particular, people of color in this country, and we want to make sure that the vaccination distribution part of our response is acknowledging that. And hopefully you'll see how we're doing that here, but I'm happy to talk more in detail and answer your questions about how we're trying to ensure that equity is the focus of every decision that we make. So I wanted to give you a little bit of an update on phase 1. Phase 1 of vaccine distribution was largely focused on shoring up our healthcare system. You all likely know that we had to open 2 alternative hospital sites. We want to be sure those sites are empty, and we want to make sure that our hospitals have capacity to operate and that they have a workforce to treat us all, both for COVID-19, but also for other healthcare services. We saw in the lockdown that people weren't accessing preventative healthcare services and other kinds of healthcare that they needed, which meant that people were getting sicker from other illnesses in addition to COVID-19. So the first phase has been focused on making sure that we protect our hospital systems and other healthcare workers, and also long-term care. We know that long-term care facilities have been disproportionately affected as it relates to death and hospitalization. And so our goal in this phase has been to vaccinate everyone in some kind of long-term congregate care facility. And we've made really good progress. You'll note that we've been progressing along each of these subgroups. And last weekend was the first time we started vaccinating what we describe as like a general population vaccination, where we targeted individuals who are 75 and older. So as it relates to phase 2, we are still in phase 1, and we'll be here a little while longer as we try to make more progress in vaccinating our oldest adults in Rhode Island. But phase 2 is going to move forward with a plan to prioritize primarily based on age. So we're going to get out of this framework where we're looking at occupation over occupation, and we're going to take a view of looking at who is most at risk to end up in the hospital or to die from COVID-19. And the evidence is clear when we look at our hospitalization and death data that it is age and comorbidity that makes COVID-19 more dangerous for individuals. And so because of that, the subcommittee and the Department of Health have decided to elect an approach where we move forward based on age. It also allows us to frankly move more quickly because we're not worrying about how to get to certain occupational groups. And so after we finish, after we make good progress with individuals 75 and older, we're going to start chipping away decade by decade based on age. After we get through a good portion of individuals who are 65 and older, we'll start to consider issues of comorbidity, and we will vaccinate younger adults who have one of a number of comorbid conditions that makes them at highest risk. You'll also note on the side, this is particularly relevant for all of you, that we are using geography as a marker of social vulnerability index. And so we do anticipate trying to move faster in communities where they have been disproportionately affected by COVID-19 and where their vulnerability is higher. So it may be that we are vaccinating younger adults in certain communities because we've moved through their older adults more quickly than in communities where they haven't been as affected by COVID-19. And we're going to do that by pushing out more vaccine into these communities and taking targeted approaches to try to get to people that are living there that are most at risk.
Director, could I add something to that? Because,
Yes.
Rhode Island is one of the only states that have used this formula of addressing geography and the social vulnerability index. So the states have not been as aggressive as we have, and that's something that we need to be proud of.
Yeah, thank you, Dr. Rodriguez. We appreciate your support in helping us to honor that. I wanted to preview for you all a little bit. There's a lot of questions about how will people get vaccinated? How should we expect to get the vaccine ourselves? And Dr. Alexander Scott will be talking more about this at her press conference this week. There will likely be 3 doorways through which people will come through to be vaccinated. The first is through what we're calling Department of Health vaccination centers. These are large-scale Department of Health run events that will be consistent with our large testing facilities now, the same kind of model where we'll be vaccinating thousands of people a day. And these centers will be located kind of at strategic geographies across the state. People may also expect to be vaccinated through a pharmacy. You may have seen that the federal government announced a partnership today with CVS. The feds are going to be allocating vaccination directly to CVS, and then we will be allocating to other pharmacies. So it may be that someone will make an appointment at their local pharmacy consistent with how they access the flu vaccine. And then the third area is what we're calling supplemental channels. This is everything from the municipal pods that the cities and towns are running to vaccination events that community health centers are running. It's consistent with the work we've started in Central Falls. These are the really customized vaccination events or ongoing activities that are really designed to target certain populations that aren't going to be able to access vaccine in these first 2 channels. And so we've committed to ensuring that we allocate enough vaccine to this 3rd row here, which, as Dr. Rodriguez pointed out, is not consistent with other states, to be sure that it's not just everyone has to go to one place, whether they can get there or not, that we're always thinking about the populations that aren't able to move through the first 2 channels, and that we're designing customized vaccination solutions for them. Another example I would offer to this is thinking about how we're vaccinating homebound individuals. We're working with our home care agencies to determine how they might bring vaccine into people's homes for those who can't come out to an event. So there will be more to come on this. Our teams are already working with the city of Providence on thinking about what these should be in Providence. But personally, this is the part of the distribution plan that I'm most excited about and proud of, because I think this will really help Rhode Island to be a model for ensuring that we do have equitable access. The council president asked me to include some data for you all, and I'm not going to go too far into the weeds because I know most of you have been monitoring the data in Providence, but wanted to show here why we are paying particular attention to our high density communities. You all know that the hospitalization rates in these communities have been the higher per capita than the rest of the state. And as such, the Department of Health has taken through all areas of their response, have identified specific strategies for high density communities. This is also true for our vaccine distribution. And this data here, which again, I'll make sure you all have in a follow-up so you can look at it. It shows more recently the increases and decreases against high density communities and some of our non-high density communities. We see good progress, but we want to be sure again that we're bringing more vaccine into these communities so that they are protected given some of the other vulnerabilities that individuals living there may be facing. So our strategy on high density communities, and as I mentioned, the team at the Department of Health is already working with the team at the city to think about how we can tailor some specific approaches within Providence. So residents of Providence should expect they'll have access to our large vaccination centers. They'll have access to vaccine in their pharmacies. But we will also be identifying targeted places where it may be better for residents, especially in your more vulnerable zip codes, to access vaccine. And we've been working with the city on this. You should provide feedback to them about other ideas you may have. We listed a couple examples here of the sites that we expect to go first, but this is by no means a limited list. And we will be anxious to identify more sites that want to provide vaccine. I do want to advise you that the distribution of this vaccine is unfortunately more complicated than many other kinds of efforts we would take on. So it does require an infrastructure that not all partners have. The storage of the vaccine, the administration of the vaccine, the federal reporting associated with the use of the vaccine is logistically challenging. And so we're encouraging communities to think about who in their community has an infrastructure to manage that, and then who are the supplemental partners that can plug into that infrastructure and help, even if they may not be able to be a provider. So before I stop and turn it over to Teresa, I did just want to comment on the events over the weekend, because I know there was a lot of swirl and confusion that happened, and I wanted to really represent the state's view of this, because I think the city did an excellent job. We've been working with our cities and towns to start our what we describe as general public municipal pods for individuals 75 and older, beginning in the middle of February. That planning has been ongoing. The cities have been working on some of the healthcare infrastructure vaccination, but it was never anticipated that we would go to the general public until the middle of February. Early last week, we determined that the state had about 5,000 doses of vaccine available to us that hadn't been used by other channels that we had anticipated would be used. And so we go through a process every week of looking at how much vaccine we're getting, which is still unfortunately only about 15,000 doses a week. And is there vaccine sitting somewhere that somebody's not using that could be better used somewhere else? And we determined we had about 5,000 doses. And so the team at RIDO, to their credit, said, our municipal partners have been asking us if we can get started with their older residents sooner than the middle of February. Let's give them access to some of this vaccine. And so the team at RIDO, Britton and Alicia, engaged with the cities and towns to say, we've got this. It's not a lot when you push it out across the state, but we'd like to give it to you because you're running your municipal pods for second doses anyway. So we knew the infrastructure was going to be in progress, but that cities and towns, frankly, hadn't anticipated they were going to have this vaccine. And, I'm thrilled to say that most jumped at the opportunity, including Providence. They could have said, we don't want it, it's too hard, we're not ready, give it to a hospital, give it to somebody else, but they didn't. They said, we want these vaccines for the residents of Providence. We want these vaccines for the resident of whatever city or town. And so what you saw last week was cities and towns trying to quickly get ready to administer what was basically a surprise allocation. I don't expect that to happen again because the cities and towns are going to have the chance to start running regular pods. And maybe we'll go to them and say, we have a little extra, can you absorb a little extra? But it won't be the kind of fire drill that you saw. I think Department of Health has recognized it was really challenging for everyone. But the results over the weekend were excellent. We saw older adults across Rhode Island getting vaccinated in their city and town weeks earlier than we would have anticipated. So at the end of the day, I'm personally proud. I think the team, Dr. Alexander Scott and the team at Health are very proud of that work and are certainly grateful to the work that the city did to make that happen, because it really was a circumstance where they could have said, no, thank you, we don't want it. And instead they stepped up and did the job on behalf of residents. So moving forward, the approach will be more planned. You'll have more notice. They'll be able to communicate more. But I kind of wanted to, on behalf of the state, take a little responsibility for the city doing, I think the best they could to get it out there and recognize that while it wasn't ideal, I think ultimately we should be proud of the results that we saw. So I'm going to pause there, and I guess I'll turn it over to Teresa, unless Council President, you'd like me to take questions first.
Yeah, so I just have a burning question. I'm going to go to Teresa, but were cities and towns told to get ready for the distribution of vaccine that they were going to be responsible for?
So they were told the teams have been planning for weeks for the middle of February, but they would not have anticipated that they were going to be doing vaccination events last weekend. We didn't know we were going to have vaccine for them until the middle of the week last week. So they basically had 2 days to figure out how they were going to do it. And some were successful and some were not.
Thank you. Before going to Teresa, I just want to give the opportunity to Dr. Rodriguez and Larry Warner to see if you want to add something from the commission, on the vaccine commission, before we go to the city.
The only thing, that I would add is that, this is, we've been building a plane that's in mid-flight. And not only that, the information that we have received from the federal government has been very, very not clear and not forthcoming, every week. So, I mean, it's amazing that we've been able to just, get out as vaccine as we have received. And I think that things are going to get much better once we get all the vaccines, once we increase in dosages, which we're supposed to be having, according to the Biden administration. And if the new Johnson vaccine gets approved, then that will add to the supply and will make this process so much better and more satisfying. People are just desperate for the vaccine, and all I've been trying to tell people, is that we have to have patience, and we have to take care of the people that are at the greatest risk first. We have to take care of the fire where it's burning the most intensely, and that's what the committee has worked on, and hopefully, by this time next year, we're all going to be celebrating.
Thank you, Dr. Rodriguez. Larry, do you have anything to add right now?
I don't have much to add. I appreciate Director Hawkins sharing the work and progress made to date, and certainly appreciate the opportunity for the partnership with the community to inform the decision-making, the priorities, and the opportunity to hear from different stakeholders and populations about their needs, and incorporate that into the formulation of a prioritization schedule that's responsive to Rhode Island's unique needs. And I think that's the value of the approach that's been taken to date. It's not a copy and paste of what other states are doing. It's really taking the CDC and ACIP's guidance and looking at the unique needs of Rhode Island's cities and towns and populations, and then formulating a path forward there. So I think that under the unforeseen circumstances that we're in the pandemic, that it's really been an attempt to take a responsive and equity-centered approach to addressing the needs of the state.
Thank you, Larry. Okay, next we're gonna go to Teresa, and then after that, we're gonna open for questions from council members. Teresa?
Thank you, Council President and council members. You can hear me, right?
Yep.
Okay. So first, I do just want to acknowledge Pima unfortunately could not make it tonight. As I'm sure many of you are aware, they were simultaneously running a clinic this week. And so because of weather yesterday and today, they are currently working on booking 700 individuals for vaccines through public safety, through that first phase that Courtney talked about. And they also, between yesterday's snowstorm and some other challenges they've been working through. So I just wanted to acknowledge that's why they couldn't be here today, but look forward to speaking with the council in the future. So I also just want to acknowledge Director Hawkins and the state team, and of course the folks here from the vaccine committee. Dr. Rodriguez stole the words right out of my mouth. Not only are we building the plane as we're taking off, but what you're really seeing, I think, is a reflection of the lack of a federal response. So I do just want to acknowledge the state for the leadership that they have shown under the governor and Dr. Alexander Scott, because really I think cities are stepping up, but really states are as well because of the lack of a coordinated federal response. So I just wanted to really acknowledge the state for the leadership that they've been really just leading us through for the last few months. So just to step back a bit, so the Providence Emergency Management Agency has been running some healthcare clinics since for a few weeks now. So I just wanted to kind of walk through that process a bit. So for everyone's context, Pima has run MedPods, medical points of distribution, and have had annual reviews of that plan for over a decade. So running clinics is not new to the nature of Pima's work. Many of you might have seen in the last few months, they've run flu clinics. And again, they've done this for years. So that is not foreign territory for them. But of course, the nature of this pandemic, social distancing, and all of the new challenges that they're facing, this MedPod was certainly different. So a few weeks ago, they began vaccinating our some of our public safety officials. So that began with Providence police, fire, and EMS individuals. So they have been doing that. They did the first dose of that for 2 weeks. And then what Clara and her team is leading, what they're leading right now is the second dose from that first allocation. So they have been working on that MedPod for several weeks now and have gotten a really great rhythm in terms of what a site looks like and the operation and really building that infrastructure so that once we did get the notice from the Department of Health, they would be ready for the call and be ready to get activated. So I just wanted to give a bit of that context just to also acknowledge the work that they've been leading for the last few weeks, which really led to us being one of the cities last week that was able to really take the call that we got mid last week, as Director Hawkins noted, and made our team as ready as possible to go through that process. The MedPod that Pima has been running for a few weeks is a regional pod. So that means that it is Providence, North Providence, East Providence, Pawtucket, and Central Falls. So in that regional model, they have been vaccinating all of their public safety officials. For last week, what you saw over the weekend was a regional pod, but it was slightly different in that Central Falls did not have the capacity to accept the additional allocation. So it was just last weekend's distribution was specific to Providence, Pawtucket, North Providence, and East Providence that we hosted here in Providence. As Director Hawkins noted, we received an allocation from the 5,000 that were made available in the middle of last week. How the Department of Health allocated the amount for each city was proportionate to their population. So Providence having 17% of the population, we received 880 doses to distribute out to our city. So for us, when we learned that news on Wednesday, our first approach was, how can we get this out and do this equitably? And so what we really determined was a few factors. One, considering the technology challenges specific to this population, when you think about folks that are 75 plus, and think about our digital divide that we have here in the city, we knew that not everyone had access to necessarily register themselves. That on top of the fact that we also have folks who have language barriers, for us, it just didn't make sense to take the approach that some folks might have deemed appropriate for their city. And so we decided, like, I'm not sure that just putting out a registration link is going to be the best decision for our residents understanding our population. And then when we also thought about it in that targeted approach that Director Hawkins outlined as well, we have some great partners, clinicians in particular, who have really great relationships on the ground, in particular on our frontline communities. So when you think about Clínica Esperanza, I'm not sure if everyone here is familiar, but they have navigantes. They have people in their clinics that are community care workers. And they have that built-in infrastructure that really acknowledges the partnership that they work with in their respective communities. So when we got the call that we had these 880 doses, our first priority was how can we partner with our clinicians who have these built up relationships, in particular with our frontline communities. And so for us, what we did was we called our clinicians and took a survey to understand, like, how many folks do you have that are 75 or older? So for Providence Community Health Center, who is the clinic that we worked with to stand up the first drive up and walk up test site in the entire state, they noted to us that they had 1,200 people, patients within their system that were 75 and older. When we called Clínica Esperanza, they mentioned they had 300 people who were 75 and older. Rhode Island Free Clinic, who primarily serves uninsured adults, they noted they had 600 people who were 75 and older. So right then and there, we understood our landscape of our clinicians clearly have a system where they can get to residents, and they can do so in a way that can really target, in particular, our frontline communities. So when we thought about it, we absolutely thought, let's partner with our clinicians who are also on the front lines and testing for COVID right now in some hard hit zip codes. What we thought of was, okay, that's maybe phase one. What is phase two? Phase two for us was, as you all I'm sure know, we have Director Sue Robio, who is our Director of Senior Services. Sue has an amazing relationship with senior service providers. So when you think about organizations like Federal Hill Health, Higher Ground, Da Vinci Center, Jewish Alliance, these are all relationships that Director Robio has been building for years and years. And so for us, obviously with that built-in infrastructure, a Department of Senior Services, Sue was kind of like tagged in as this phase two. If clinicians do not have the capacity to reach 880 individuals, let's go to our Director of Senior Services who has these relationships with folks outside of not, high rises or anything like that. So that was kind of phase two. And then phase three for us was, if at the end of the day, we do see that we are not filling all 880 doses, how can we open this up to the wider public and make sure that we have staff available to fill this out for them, people who are bilingual, who can walk someone through the process to register through the Department of Health portal. And so for us, phase three was, if the appointments are not filled by Friday, let's open this up to the wider public and make ourselves available, call in anyone that we need to so that we can answer calls. And so at some point on Friday afternoon, we realized we still had about 100 appointments open for the weekend. And we decided we just needed to open this up to the public and call in everyone possible to just start answering phones. So we called in folks from the communications department, recreation, from the council office, the chief of staff, PJ Fox, made himself available. And we started just answering calls from residents who could help us fill that slot. For us, it was really important that we not send one dose back. We had to make sure that 880 doses were put in the arms of residents in the city of Providence. So that's what you ended up seeing on Friday, was a push to make sure that every slot was filled to the best of our ability. And fortunately, we did get to that. And by the end of the weekend, we used every single dose and did not send any back, which I think was obviously reflective of the entire team just jumping in, but more importantly, I think the preparedness and the work that Pima has been leading for months now to get us to this point. So I think that's kind of a high level, and then I'm happy to answer questions.
Thank you, Teresa. With that, I just want to open the floor to the council members that have questions, either for the our guests from the state, from the Commission on Vaccine, or for the city. Let's see. I see Councilwoman LaFortune first, and then Councilman Goncalves after. Councilwoman LaFortune.
Thank you, Council President. Thank you so much for that wonderful presentation, Ms. Hawkins. That was really informative, and thank you, Dr. and Rodriguez and Larry Lerner for being here, and thank you, Teresa, for the update. This is really informative. So, all right. So my first question is, do you have any data results from this past weekend's vaccination initiative or this past week? It would be interesting to see, in just reading about other cities throughout the country, how people from like would come into different neighborhoods or different sectors when they were targeting marginalized communities. And so it would be wonderful if you could provide some data on what the percentage of people who got vaccinated live in the city of Providence, and what disaggregate the data to show what neighborhoods those folks are coming from, so that we can have a better understanding of who is partaking in this initiative, and also try to figure out if there are people not coming from different neighborhoods, what are the barriers that are preventing them from accessing the vaccine. One thing I did hear from some, people that I reach out to, when we think about the population that we're trying to vaccinate first, 75 and older, and also during these winter months, there are many people who don't drive in the snow. Like one of the people who got vaccinated, she's 91 years old, and she's like, I am very nervous. She was like, I'm happy that the snow didn't start, but I'm nervous about my second vaccine. If it snows, I'm not sure how I will get there. It would be wonderful if there was more of a community approach. Two is, are you all thinking of partnering with maybe, and you guys are having conversations right now, but in terms of like receiving the calls 211. So there was a lot of confusion too when people called 311 because the Mayor's City Services was closed and it went to public safety, and some people just didn't make an appointment because they were a little nervous, they weren't sure what to do. So, and with 211, sorry, Larry, I'm putting 211 on the spot, but you guys do such a great job. It's 24 hours, 7 days a week. And I think because, it is like United Way is a social service like entity, people are more comfortable to share personal information with them. The other thing is, are you all also thinking about taking a more community approach, and rather than having people go to these different sites, because I'm assuming mobility is going to be a concern. If you're going to do anything with like Lifespan community health, workers who have been doing vaccinations in the neighborhoods, they're literally going into church parking lots, school parking lots, and vaccinating folks. So that way people are not going elsewhere, but we are coming into the neighborhoods to provide vaccination. And if there is a mobility or access to transportation issue or mobility issue, the communities can coordinate to maybe have like, shuttles, as long as we're following safety calls, safety protocols, etc. And finally, can you just provide a little bit more detail? Because I know that people were told when their second vaccination will happen. Will there be some sort of tool? Because I do fear people might forget to call folks or to remind them. What is the follow-up process that you all are initiating to ensure that people do get the second vaccination? Because you have to do it within a certain time frame for it to be more effective. And that's it for now. Thank you. Thank you so much.
Thank you, Councilwoman. And let me just check with Councilman Goncalves. Is your question related? Do you want to add it now, or you'd rather wait until they respond?
I can wait until they respond. I think that was a lot, so I'll allow
Okay.
them to respond to that.
All right, thank you. Director Hawkins, would you do it, or Teresa?
I'm happy to start, and then Director, if you want to hop in, because I think some of them were a little more city focused. So in terms of your first question, Councilwoman, in terms of data, so how we registered people for the first vaccine and for the second was through a system called PrepMod, which is through the Department of Health. So I actually am working with DOH, with Sheena from DOH, who's on the vaccine team, to get a better understanding of zip codes and get a better sense of that data from the weekend. So that inquiry was sent over this morning, and we're trying to have a better sense of what that looks like. But that data it's like submitted through a state portal. So we're trying to better understand how to access that. So we can certainly provide that to you as soon as we get that. Regarding your second question, which was a little more about like clarification of the phone system. So City Hall usually closes at 4:30. What we did on Friday was, once we acknowledged that we still had appointments to fill, we extended our hours until 8 p.m. So we had people answering calls until 8 p.m. And so on Friday, our city team actually answered 754 phone calls. And once we turned off the phone system, that was because we actually had no more appointments available. So when people were being sent to the dispatch, that was because we realized that some folks might get lost on Saturday, and we wanted to have at least some type of system, even though we couldn't register them for appointments because we had no vacancies. We wanted someone to be on the other line who could say, hey, this is how you get to this site. This is, it's on this street, that kind of thing, because we didn't actually, as we were building the plane, we realized that we didn't have a phone number available on Saturday or Sunday in case someone was lost. Like, who could they call? So that was why we were forwarding calls. But on Friday, we did have those extended hours until 8 p.m. And we answered just over 700 phone calls. Regarding your third question, we're certainly looking into that. We've also seen some cities do like a drive-through approach, going to people's homes. We're trying to better understand what the infrastructure looks like. So just to give a sense, on Saturday and Sunday, we needed EMS on site to monitor for allergic reaction. We needed some certain people with medical credentials on site to actually be able to put vaccine in arms. And if that person wasn't on site, we would not have been able to administer those doses. So there's just some infrastructure we have to build and better understand to do drive-through or home visits. But PIMA is absolutely looking into those. And I think that's a really great point, in particular for folks with mobility and transportation issues. And I also do want to shout out to that point. Providence Community Health Center was actually shuttling people on Saturday. And so just, at the 11th hour, they had staff available to book appointments, but also like literally getting people there. So transportation, I definitely think, is going to be really critical, acknowledging our population. Regarding the follow-up process for people who will come back in the end of February, PIMA is actually using their code red notification system to notify people, and we're still building out what that looks like to make sure that people don't, forget about that appointment. You're right, it is absolutely vital that they get that second dose. So they are doing that before the appointment. And we're making sure that we have folks available in multiple languages, because one of the questions that was on that form was language preference, so that we could also, if we need to make a phone call in Portuguese or Spanish, we have someone in that language who is reminding them of that appointment. And then happy to kick over to Director Hawkins if I missed anything.
Teresa, I would just add two quick things. So one, Councilwoman, I am also very worried about people swooping in to get vaccinated from other places. The municipal pods is actually where we solve for that. Whereas if a CVS in Providence is vaccinating, they're not going to limit to Providence residents, but the municipal pods are targeting your residents. And it's why we want to continue to work with cities, especially Providence, to provide vaccine, because that's going to be the place that we can guarantee Providence residents are getting access. So just so you know, that is on our mind. The other thing I would say is on transportation, also something we're thinking about for everyone's awareness, residents who typically use NEMT transportation, so that would be MTM primarily for non-emergency medical transportation, they can use NEMT to get to a vaccination site. So you can help us get the word out on that. I don't think we've communicated a lot about that, but we'll be doing more. So if people, need that level of assistance, either just a ride or they have other kinds of barriers, MTM should be able to help them with that as well.
Okay. Thank you, Director. So I have next Councilman Goncalves, then I have waiting Councilor Miller and Leader Ryan. Councilman Goncalves.
Thank you, Council President. First and foremost, I want to thank Teresa and PJ and Clara. Tracy, who's on this call, Ben, and all of our city and state partners, and truly everyone who had a hand in the vaccine rollout this weekend. So thank you for that. And thank you, Courtney, for your work, Dr. Rodriguez, Mr. Warner. It was a Herculean effort. And so I want to thank you all for shifting on a dime and for your hard work and swift action. I can only imagine how hectic it was to coordinate everything without so much advance notice. But there were several people who reached out saying it was well organized, it was safe, it went smoothly, which is testament to your leadership. So thank you so much. I appreciate you addressing those who are homebound and have mobility issues, but what important communication channels are being used to reach some of our most vulnerable residents? And as you mentioned, Teresa, there are a lot of families that don't have access to technology. And so what are the specific ways that you all intend to reach these folks directly moving forward outside of your existing partnerships and outside of maybe the mainstream media? In what ways can we help facilitate that as council members?
Yeah, I'm happy to start. And again, Director, if there's anything you want to jump in with from a state perspective. So that's a very important, I think, piece of the puzzle is how can we get to as many people as possible? Certainly relying on our clinicians who have those relationships, using means like social media, the mayor's going on Latino radio, using all of those mechanisms. But additionally, what we've seen the state do, some people, I don't know if anyone on this call has gotten leaflets at their doors. There are several canvassing efforts that they've been leading. So we're trying to better understand how we can integrate into whether there's a canvassing effort, whether there's a drawer drop of like door drop literature, something to that effect, similar to what you see on campaigns. We're actually joining, the Department of Health is hosting a communications call on Thursday. So we're gonna try to, put everyone's heads together and get a better understanding of what we can all coordinate on. But I think you're absolutely right. We can't just rely on technology. We're trying to meet everyone where they are, which I think is a really important piece of this conversation.
Thanks for that, Teresa. And I have another question just quickly about the streamlined portal in which people would use moving forward. So, we could tell that a lot of our 75 plus homebound residents are trying to perhaps reach 311, but that can sometimes be a black hole. And I think it's important to alleviate some of the anxiety for folks who are hoping to set up an appointment just for peace of mind, but don't have the opportunity to do that right now. There seems to be lots of different portals. So we've got, the special needs registry, we've got Vaccinate PVD. We also have the state building a portal. What portal should we direct our residents to, and what's going to be the most streamlined and most effective way for them to get that information as to when they can sign up for a vaccine?
It's a great question, and I'm going to start by saying I wish my answer was easier. It is frankly not, because there are going to be many pathways to vaccination. The state portal will be the best place for residents to indicate they want information about when they're eligible to get vaccinated. So there will be more information coming in the next week about how to sign up. There will be a way for people who can't sign up on their own to call in and have someone help them sign up. It's purely a list where we're going to be pushing out information to say, we know that you are 67 and we are opening it up to individuals over 65. Here's what you should do. So that will be clear. What will be hard, and we will use your help in continuing to push out this message, like testing, there will always be multiple pathways to a vaccine, and there's no way around it. And so you may sign up at CVS, for example, you may sign up with the state, or you may decide to go to a local vaccination event. That is not going to change. We're trying to limit it to those three categories to try to keep it as simple as we can. But similar to testing, there's going to be different opportunities based on where people live and various risk factors they have. And so over the next couple of weeks, RIDA will be working to communicate that and produce materials that you all can use with your constituents to help educate them. We're really going to be leaning on people to help older adults in the community to understand, because we recognize this is confusing. And frankly, this is a result of the fact that there's not a national vaccination strategy. And so we're all moving on lots of levels. But there will be more to come on that. And we would certainly encourage you to encourage people to sign up for the state, interest list as it is, so that we can continue to communicate with them.
Great. Thank you so much.
And I want to go. I'm sorry. I want to go to Larry. Has his hands up. I think he wants to contribute on this discussion. Larry Warner.
Thank you, Council President. In addition to the resources that Director Hawkins mentioned, the state's Office of Healthy Aging did share that the Healthy Aging Help Desk, the Point, which is operated by United Way in partnership with the Office of Healthy Aging, is a resource that can be contacted for information or to be connected with the appropriate local senior center or whatever resources are made available at that time. So that's a 7-digit phone number, but also can be connected by calling 211. So that's another way to connect folks who aren't connected online with information as well.
Great. Thank you so much, Council President, and thank you all for your responses. Thank you for all that you're doing.
Thanks. I know, Teresa, you were going to add something. I just want to let the people that are waiting to know that I see you. So I have Councilor Miller is going to be next, and a council leader, Majority Leader Ryan, and then Deputy Majority Leader Harris. Teresa?
Yeah, and I just wanted to add regarding Vaccinate TVD. So once we opened on Thursday morning, we started getting phone calls of individuals who were not 75 or older. So we noticed right away there was a clear demand of people who said, as soon as you have information, I want to be kept up to speed. So that was why we built a notification form, because we started getting so many phone calls of people who did not meet that criteria of being a Providence resident and 75 or older. And since Thursday, we have already received over 4,000 Providence residents who are ready to get vaccinated. And so what we did was we mirrored that timeline that you saw from Director Hawkins with the age ranges, so that as soon as we have any kind of information, we can push them to that state portal, but it could just be another touch point where we can say, hey, you said you wanted to get vaccinated. They just made this available for, 65 plus. Here's the portal. We just wanted that other touch point because there was clearly a demand from Providence residents who were calling in that they wanted to be notified as soon as possible.
Thank you. So with that, I'm just going to go now to Councilor Miller, then after Leader Ryan, and then Leader Harris. Councilor Miller?
Thank you, Madam President. And I just want to echo my thanks to everyone who's on this call, from the state, from the advisory committee, from the city, and especially folks who helped make what happened last weekend happen. It was a huge lift, and it was a remarkable effort. I also just want to lift up quickly the Director of Senior Services, So many folks that I called on Friday had just been contacted by her that morning or whatever. So it is a remarkable resource in our community. So thank you for that. I have a question specific to the regional pods. So just a better understanding of one, how we landed with Providence and North Providence and CF and East Providence all together. And two, I don't really have a clear understanding of how that works logistically. Like my understanding is Netaconicket was the center for three cities and towns this weekend. Four, yes. So yeah. So how does that work logistically? How are we sharing resources? How is Providence sharing resources? Or it feels like Providence is carrying a load here, and so I'm just curious about how that works and how we can help. And then my last thing is less of a response and more of a statement, which is just that one of the great things that happened this past couple of days was the communication from the city. And thank you, PJ, for stepping in and sending us those messages. That kind of effort is so helpful. I know that residents are looking for also that level of information sharing. And so I know we're all under a tremendous amount of pressure to get moving, but the kind of more clear communication, the better off we all are. Teresa, you had mentioned some potential like community neighborhood drops. I know I would be happy to participate in that. I think other people would too. So even lines of communication on like how we can all kind of pitch in to help. But so that first part on the regionalization is my main question. Thank you.
Yeah, so I'm sure Clara could answer this in a better, more detailed way, but my understanding is the Department of Health chose the regional cities for each med pod, so each regional site. So that was decided by the Department of Health, although I will anecdotally say that they're all amazing partners, and so it was a forced marriage, but we're very happy with it. So I do want to acknowledge they're all certainly pulling their weight and working very diligently with our team. In terms of how it logistically went, so obviously Providence had a larger allocation based on our population size. So what happened over the weekend was the three other cities, Pawtucket, North Providence, and East Providence, were during a morning shift, and then Providence was an afternoon. And then the next day, Providence was the morning shift and the other cities were the afternoon. So that was kind of how it was managed logistically, because obviously our allocation was so much higher because our population size is so much larger. In terms of allocation and some of those pieces, so the DOH provides the resources in terms of vials, Band-Aids, like you named those kind of mechanics to a site. So that is all provided by the state. The city is organizing for vaccinators. So the vaccinators that we had over the weekend and that we have had for our sites for public safety officials have been Providence firefighters who are eligible to provide vaccinations. And that is FEMA reimbursable because we are in a state of emergency.
Actually, I just want to add to, Leader Ryan, you're next, I promise you. I'm not going to take a lot of this time. But just connected to the question that Councilor Miller had. So I understand the communication, what you guys explained, but I do have concerns about the way how the communication went and how us reaching out individually, was there really equity on that process? Did the people that, the person who, somebody gets in instead of being more fair to everybody else? And I'm gonna go to Leader Ryan, just being patient, but you guys wanna start thinking about that, we can come back here. Leader Ryan.
Thank you, Council President. And thank you all who made presentations today. We really appreciate it. I'm not going to join my colleagues in praising everyone because certainly you did a great job. I understand it was short notice, and like anything else, hindsight is 2020. I'm sure we learned a lot. And I'm sure that we're going to use the information that we collected over the weekend regarding data of who showed up. And I'm sure you're going to evaluate that in planning going forward. I fully expect that. I do want to take the opportunity to thank our council team who helped bring the council up to speed as quickly as possible. We greatly appreciate that. So thank you to the council team. Question for Teresa on the community partners. You had mentioned the plan crafted was based on the understanding that our partners had identified a number of people. Based on what you said, I counted, I don't know, over 2,000. So this weekend, and again, I don't want to belabor this past. I don't want to talk about the past as much as I want to talk about the future. But how many of the 880 shots that we gave out this weekend were generated from that effort? Do you know that at this point, or do you have that data?
We don't know that right now.
Okay. Because I do know that there was quite an effort by everybody involved. The council was pulled in to try to help to make sure that no shot went wasted. So I was just kind of questioning that aspect, and that goes to what the council president was saying, because we felt uncomfortable in that process in saying, you know, is this equitable? Is this fair? No one wants to jump the line here. So that brings me to next couple of thoughts I had. But first, couple of direct questions. Who is the Providence COVID task force, the response team? Who are they made up of? Is it the mayor's staff? Could you explain that?
Sure. So it depends what COVID relief or response you are asking about.
Who sits down and makes the decision as to how Providence is going to utilize? Who sat down and made the decisions relative to the utilization of those 880 shots? Who is that team?
So, yep. So as I was explaining, so it really depends when you're thinking about the greater team. So it's obviously the chief of staff is involved. Pima leads the COVID response in recovery. So Clara DeCerbo, Brittany Card, Kalia from Pima runs our volunteer efforts. So the entire Pima team is involved. If it's, it really depends what is involved. So Healthy Communities does a lot of food distribution. So our Healthy Communities team is involved. The Commissioner of Public Safety is certainly involved because we have sometimes allocated ambulances to be COVID ambulances at a peak during the pandemic when a lot of people were calling in and had COVID-like symptoms. So it really depends. We have folks who are specifically working on homelessness, on business support. So the team fluctuates depending on the topic. I'm certainly on it. Tracy is involved from the perspective of serving on the Equity Council. She listens in on the vaccine task force calls as well. Certainly if it's about reimbursements, Larry Mancini is involved in our operations team. So it's a pretty big team, and it depends on what piece of COVID response and recovery we're talking about.
Okay. I would like to see someone from the council also be on that task force, largely because we communicate on a regular basis, on a day-to-day basis with every neighborhood in the city of Providence. So I think that you can tap into our known basis of communicating with residents, which gets me back to, thank you very much, Teresa, for answering those questions on budget. Is this outreach effort, Mr. Mancini, is this a COVID qualifying expenditure notification and operations, I guess? Does this qualify?
So, Madam Leader and members of the council, good evening. As Ms. Agonia had pointed out, where instances are identified by FEMA as administered by local Pima, that would qualify as under the declaration of emergency for reimbursement. Yes, that is reimbursable. She cited an example where we used EMS personnel, firefighters who were able to be qualified and trained in administering vaccination shots under the pandemic emergency with the vaccine rollout that would qualify for formal reimbursement.
Does the state provide additional funding, or does each municipality bear the burden appropriate for its operation?
I'm not clear on that, but it's my understanding that the city's responsibility is mostly an in-kind because we provided the personnel and facilities and perhaps other supplies, but I'm not sure what the responsibility is from a financial aspect of the state.
Larry, Alicia could address that from RIDO as well.
Okay, thank you, Director.
Thank you, Director. Councilwoman, so each municipality currently has a contract with the state for this particular program. So there were specific planning elements that the city is eligible for reimbursement for, as well as the execution of the pod. The regional pods are also eligible for additional funding. Those host sites, as Teresa mentioned, Providence was the host site to 5 other communities. So there's additional reimbursement, knowing that there are additional costs for the use of the building, for instance, the custodial staff to ensure the opening and closure and cleaning of the building. So those funds are all either already available. The first 3 sets of funds are already available, and the follow-up for the regional model is on its way.
Thank you. Are there funds at either a state or a city level for a global communication mechanism? Has that been allocated or contemplated? Whoever would like to answer that question.
To a couple of things, and tell me if I'm not answering your question. So the statewide interest list that we're going to use to collect interest and then push communication out to people, that will be paid for by the state. The state has been doing targeted campaigning, as Teresa said, door knocking materials, that's all being paid for by the state. There hasn't been local communication dollars allocated, but certainly would be something that I think the state would be open to talking to municipalities about. The regional pods, as they're currently structured, are not intended to go forever. And so actually in the future, Providence will probably just handle vaccination for Providence, and unless they decide that the forced marriage has worked so well that they'd like to continue. And we are open to conversations with cities and towns and community-based organizations about how they can help with communication, getting people signed up, all of that, because we know that that is better done at the local level. And so Clara could bring that forward to RIDO as we think about how we ensure that we're pushing vaccine money into cities and towns where we can.
Thank you. So I'm just going to conclude with these remarks, if I may, Council President. And to me, communication is key in this whole endeavor. I think we all agree on that. And it strikes me that I heard over and over again this weekend, and when I've been speaking with my constituents, they keep saying, how will they know I exist? And that's that's pretty common in the older groups. And that's a real valid thing. So I guess this whole weekend's exercise, and I agree it was heroic. And again, I can't thank you enough for the effort. But I think what happened, the reality is, it scared people more than the small group of people that went, they got their shots, they felt really good about it. They really did. I got many, many calls. But it stirred anxiety on, a natural mistrust that goes along with things like this. Oh, people are getting it to their friends, I'm being left out. All of those kinds of thoughts were prevalent. And I think because there were a few shots, you had to get them out quickly. And I think that the target audience was an older crowd that doesn't communicate well through social media outlets. And, we're getting second and third party conversations about what was actually happening, or communications with what was actually happening. So we got it out. I think that's great. I think we caused a lot of anxiety in the process. So now knowing that, I'm particularly concerned about making sure that our communications should be broader, initially global, about answering the question of how do I register, or how do people know I even exist? And as a council person, I can honestly say, I don't know what to tell people. And Teresa, kudos for Teresa for saying we've got incoming calls. We need to get people registered if they don't qualify for the shot this weekend. But as a council person, I hesitated to send that out because I said, I don't even know what the plan is. Am I giving the best advice? So I guess and I'm not asking for an answer today, tonight, or whatever, but I just want to make clear that the anxiety is real, and it is intensified by not being able to communicate in the traditional forms of communication that different age groups are comfortable with, different language groups demand or require, and also, timing, just getting the information into a household that have different work schedules, and the very fact that it's just really hectic right now anyway. So I guess a global communication to me is really key. I think if we revisit last weekend at all, and I'm sure you're doing this, I think it's for the purpose, quite frankly, of seeing if we can do a better job. Again, the question of how do I register and what vehicle do we push out consistently, and whether that vehicle, and I thought, quite honestly, that, I was happy to see that the state was managing the registration, because obviously you have a federal reporting requirement. It's consistent, it's safe, you're registering for the right thing. But I'd like to see a registration for those other age groups ahead of time, so that they don't have to oh my God, I got to register this weekend or I'm going to miss this opportunity. And what roles do our traditional healthcare providers play in that? And I'm sure you're having those discussions, but we don't have that knowledge base. So, and we can't do a gap analysis because we don't know what is being done. So global communication, who are the partners? Who are the audiences that they're trying to reach? How is that happening? When is that happening? And making sure that the council can't play a role in making sure that there's publics missed if we don't know who the publics are and how you're trying to go about reaching everybody. Because bottom line, we all want the same thing. We want to get everyone vaccinated as quickly and as efficiently as possible, and we want to do a good job. So those are my comments and thoughts. I won't belabor any, I won't take any more time. But how are we getting people registered? And please tell me what I push out. And whatever we're pushing out, we should be pushing out the same consistent message. Just the same way the signing up for a shot or a vaccine is consistent. It's from the state. When I go on that site, I know I'm in the right place. There should be the same thing. It shouldn't be every municipality doing something different. As far as the registration piece and as far as signing up for the shot. I think those are two real critical components of this whole thing. Thank you,
Thank you,
Council
Leader
President.
Ryan. So I have next is going to be Deputy Majority Leader Harris, then Councilman Espinal, then I'm going to go back to my original question, and I also have a question about language access for the state and for the city. So Deputy Majority Leader Harris.
I actually was waiting for the feedback, a little bit of the feedback, because I'm documenting a lot of this stuff. My question is only 2, so mine is just 2. I think something is left out, so I just want to add my 2 pieces. But if you don't mind, I want to hear, that was a lot. I don't know the answer, but if you don't mind, I want to hear some of that, because all of that is from Councilwoman LaFortune's statement. All my colleagues have spoke about things that have been my concern, but I would like to hear more from even if I have to yield the floor.
All right, thank you. So I'm going to go to Councilman Espinal because he also has been waiting for a while, and then we can come back to our guest. Councilman Espinal.
Thank you so much, Madam President, and members of the council, and everyone on this call. All the directors, thank you for your effort. I must echo those words expressed by Leader Ryan. It was very concerning, a very interesting indeed weekend. It's a monumental effort to try to get such a limited amount of doses of vaccine to such a large population. I wish that we could do it all in one day. Obviously, that's going to be impossible. So that brings up a lot of challenges. My understanding is that the target zip code were 02907 and 02909. Now, I'll tell you, within 02907, and you're going to have a majority of the 75 plus population that do not speak the language. They do not speak English. I happened to be on Saturday right next to an 88-year-old lady that got a text saying, click on this link in order to register. And she does not speak the language. And that was actually my mother-in-law. So I'm happy for that, because whatever system is in place is actually reaching the citizens. But understanding that also that is not reaching them a great majority in the proper language. So Councilman Goncalves actually asked the question, and Teresa to answer it, but I'll ask her again in order to reemphasize that effort needs to be made to reach the non-English speaking 75 older population in their native language. So to Teresa, we need to emphasize on that. We need to design a system where we are going to reach that population in the native language. And I think it's also critical that if you want to have an effective plan of action, if I was you, I would actually include the council. There are 15 wards, and I guarantee you, and I can assure you, that each council person knows his and her community. When I got the call, and I like to thank PJ for letting me know what was going on, I immediately pulled out my black book, my list, and I started calling some of my constituents that I knew were 75 and older. So I think that you're gonna need partners in this effort. Your best partners will be the council people. So, Leader Ryan said and suggested that you put someone on the task force from the council. I echoed that. I think it's a great initiative. So in moving forward, again, I definitely don't want to look back, but let's take this as a practice, as a learning experience. During this pandemic, a lot of curveballs have been thrown at us, but all we can do is deal with it. And I think we're on the right track of making the system better, most effective. We're all in this together. We're all partners in this. We want to make sure everyone gets vaccinated. We want to make sure everybody survived. And believe me, this is coming from someone that lost a good number of families. I lost 8 relatives to this pandemic so far. So it hits me hard. So I do want to see everyone get vaccinated. I do want to make sure that no one gets left behind. It is a war, so I use that term, no one should be left behind. It is a war against an invisible enemy. It is a war against a virus. So we need to unite. We need to pull together and show our strength. And we can do that through unity, through communication. And again, I just want to end by thanking everyone on this call for everything you do and for the effort that you have got to come to put together today. To you, Council President, thank you so much for initiating this conversation. Thank you.
Thank you, Councilman. And I'm sorry, someone was gonna, Teresa?
Oh, respond and really elevate what you just raised, Councilman. Certainly as the daughter of immigrants, but as the daughter of a mom at home who English is not her first language, we speak Portuguese at home. It's just such an important part of this conversation. The tech abilities and everything else is another added layer, but I just really want to elevate the language because I even see it at home with my own mom. So I do want to acknowledge and just emphasize that when we were doing our intake process this weekend, both registering appointments and at the vaccine clinic, we had bilingual folks on at all times. Our volunteer coordinator is a Latina woman, and so we at all times had someone available who could speak Spanish. Myself, I also speak, in addition to Spanish, Portuguese. So I do just want to like elevate that language barrier is very real for our residents. And the other piece that I do just want to acknowledge is just to make sure that everyone has a sense. I don't know how many times I spoke with PJ over the last week, but every time I had an update, I was calling PJ. Before we sent out a public registration process, we absolutely gave a heads up to PJ before that went out. So I do just want to acknowledge and thank PJ for one, making himself available to help us with phone calls, but also answering all of the numerous calls over the weekend. So I do just want to acknowledge PJ and taking all of those phone calls over the weekend.
Thank you.
Thank you. I want to just touch on what Councilman Espinal was saying, and I had on the floor a couple more questions. So it's really tough for us that has experienced loss of a relative from COVID. When we were approached over the weekend, letting us know that there are vaccine available and to reach out to people that in our communities, it was really hard not to think about what if there are people out there that are not getting this information. So I think part of what the Council Leader Ryan was saying earlier is something that we can learn, and I agree that you guys did a big effort over the weekend, but the concerns that I had is I didn't feel okay calling, reaching out to individuals to send you the names, because I'm not sure if someone else that needs it more than one sending you is not getting it. There's also the concern about how was the information spread when it comes to language needs. Here in Providence, we have a large population of Southeast Asians. How do we make sure that this information got to them? How do we make sure that it got to the Latinos, the individuals that don't speak English, that only speak Spanish? So, and I think the important thing is to learn from this process. So moving forward, we take this into account before. Teresa, you gave us a lot of information about things that happened prior to us learning about this vaccine available, the contact that you did with the partners, with the health centers. We didn't have that information. We had no idea that all this work already happened. So it was really hard for us to, it felt like, you know how they always says that you need to know a guy? So it felt almost like it was, you have to know a guy to get a vaccine. That's how the process felt for me over the weekend. Besides that, I would love to see the data about who got the vaccine, and I want to see the data compare to the neighborhoods and the population that have been affected the most through this pandemic. I understand that, yes, it was a tough process. You guys did a lot to make it happen, but are we leaving people behind in this process? And this is what I want us to stop, think, and analyze this process that took place and how we improve moving forward.
So if I could just quickly respond, Council President, I certainly appreciate your feedback. Obviously, only having 2 days notice was the dark horse of pulling off a vaccine clinic. So I can't underscore enough that, you know, we had 2 days notice. We felt that what drove our registration was a lens of equity, which was prioritizing health clinics that are on the front lines. And that is exactly why we prioritized making ourselves available to folks like Clinica Esperanza, to Rhode Island Free Clinic, to PCHC. And that is why we went to those partners. And I just want to absolutely bat down this idea of Noah Guy because it was absolutely not our approach whatsoever. We led with partners that are literally serving in frontline communities, Clinica in 02909, Rhode Island Free Clinic in South Providence. So I do just want to like emphasize that and underscore that our senior service director was doing the same thing in the partnerships that she has established and reaching out to seniors. So I just want to like absolutely underscore that. Of course, this weekend is a lesson learned for all of us, but I just want to like really underscore that point. And my understanding is as soon as we had information finalized, which we did Wednesday night, the director of PEMA sent a notification to all Providence elected officials on Thursday morning outlining that process. I know a few council members in particular responded to her email, so I know that that was sent out on Thursday morning. So I did just want to like also amplify that.
I'm trying to speak and I was muted. So again, my issue is with the process of, let's call, we have vaccine available. It should have been a better process to communicate that, that it was not so, okay, who do you know? Who are you gonna call? It should be a process that is more general and that is more open and more transparent with that. And we have to, what I'm asking for is for us to recognize that that was not the best process and how we make changes moving forward. I'm just gonna check because I see some hands up. Deputy Majority Leader Harris, are you expected? Do you want to speak now?
Yes, you actually led me into what I want to say in this in the whole thing, because I do have a couple questions, but I want to go back and say that everything you're saying, Council Pres, is the perception of what happened. And one of the things that I believe what you're trying to say and what we need to be saying is that this is a medical issue and we're trying to keep the politics out of it. And if we keep the politics out of it, that's where the equity will come from. And I think you all have said it so well. I've been like just listening and documenting. I happen to hear about this, and I called this young lady Tracy. Tracy haven't introduced herself, but she was like really informative about what really happened, you know. And Dr. Rodriguez have already brought it up. You know, he have already said that, you know, we focused, we had to get it done. Providence, yes, we want, and our director Courtney Hawkins, we all know, she said, yes, we want it. And Councilman Espinal has said it so well. We want to make sure that everybody get vaccinated. And Council Pres, that's what you're pushing for. We want our partners to know that this is not politics for us as councils. We really are looking at equity in a real kind of way, because it has shown us as leaders here, as council people, that in this pandemic, something have surfaced to the top, and it ain't something that we appreciate when there is an imbalance of people, and especially in health and lives. And my condolences to both Council President and my colleague Espinal for all the losses they had. You know, I feel, you know, we all feel when you feel in the place that you are, because we don't know who's next. And so this is where we are right now. Councilman Espinal said it so well. We want to be cheerleaders of whatever the health department or all of those are doing. PJ proved it this weekend by just getting in the middle and, you know, making sure that he was giving information to us. But everything my colleagues have said about communication, because communication is what we have to do with our constituents. And I don't tell my constituent a lie. If I haven't found out anything, I say, I don't know. And when Miss Barbara Thurman called me up and said, did you know about the vaccination? As much as the mayor's office called her, I said, no, I did not know. And none of my colleagues knew. And none of us as city councils knew right away what was going on there. So we learned the lesson. I appreciate everything that was done, because listening to Tracy, that was something that think fast, move fast, let's get it done. And then listening at the rest of how the platform is being built around other things, equity, access, geographic. I appreciate Providence having such a clear understanding in Rhode Island itself on what we're going to do, because other states are struggling too. This is not our fault, but we want to work together. I think our ultimate goal, and I think everybody agree, our ultimate goal is to see everybody fairly treated. And I think that's where the councils are standing in right now. There is no politics involved in this whatsoever with us. We know it's a health crisis. We have direct contact with our constituents, the people we serve, and it's a no-brainer what Councilwoman Ryan has said. That's no-brainer what Councilwoman Mathos is pushing on. And my other colleagues, everybody said basically the same thing. Inform us, keep us informed so we can inform our community. Now, my question, finally, the first vaccination was given. I do know there are some problems with people not going back for the second one. Is there a plan in place to push for that, some kind of strategy around how do you get people back for the second one? Because I understand if you don't get the second one, yeah, you could be in a bad place. I have a second one, which is, we talked about all the vulnerable populations, and you guys know, all you know me from the time I entered into the city hall, I always talk about the people who sleep on the street, the homeless, the people that is forgotten in many places. I would love to know, maybe not today, because you guys I know going to keep regular communication with us, what would be the plan to reach that group? Thank you. Thank you, Council President. Thank you for this night. This is important.
Councilwoman Harris, thank you. I was hoping you were going to ask that question, and it's like I knew you were going to ask it on individuals experiencing homelessness. RIDO's actually done an exceptional job of escalating the needs of that community, kind of ahead and outside of the age-based strategy, because we know it's so complicated. And so the team has been meeting with homeless service providers, and we'll be launching a pilot to start to vaccinate that population over the coming weeks. And we're working closely with Amos House and Crossroads and House of Hope to be sure that we get second doses to that group. That's the thing I'm most worried about. But want you to know it's top of mind for us, and we have prioritized it, and we'll continue to as we move forward.
What about the people who have had this first dose over the weekend and the ones that will not return? Is there some kind of thinking behind how do we win them? And one more question, Madam Chair, if you don't, Madam President, if you don't mind.
Go ahead.
Have you considered any kind of media on the our radio, Spanish radio stations? You know, a lot of broadcasting there. I love the way the census was done. I really appraise and appreciate the people who did that from grassroots and collected names of people and their information on undocumented people. Just hearing that information was great, where other cities were struggling. I always brag about Providence being the best. We're the first at everything. We're the best at what we do. So I'm hoping we can be of help. We're not trying to be adversary with this thing. I just want you to understand that the council is approaching this with, we care, we want it to happen, we want as many people vaccinated as possible, according to Councilman Espinal and everybody that has talked already. So thank you.
Yeah, absolutely, Councilman. I'm happy to answer those questions. So to your first question regarding the second vaccine distribution, so that'll be towards the end of February. The plan at this point, Pima is of course running point as the leader of the pod, and they will be sending a code red notification as a reminder to folks, and they can, I'm sure, speak to the more in-depth plan, but they will lead a robust campaign. What they also did this weekend was if someone didn't show up, they were calling throughout the shift to make sure to get people there. And that was how we got a lot of people in on Saturday and Sunday. So Pima does have a plan in place to make sure folks show up. Regarding your question about radio visits, absolutely. I think that has to be one piece of the puzzle. The mayor himself is going on 2 Latino radios tomorrow to talk about what we know at this point. And of course, that is limited. But I absolutely acknowledge that like radio visits definitely has to be part of the plan. And I think, you know, at the end of the day, we all have the same goal, which is get as many people vaccinated as possible in the city of Providence.
Thank you, Teresa. Can you also include, maybe for a follow-up, how is the outreach for the Southeast Asian community? What you guys are doing for that community, especially those that don't speak English? And I know this meeting we're already like an hour and 40 minutes into the meeting. I'm just gonna do a final run. I have seen the hands of Councilwoman LaFortune. I don't know if you forgot to put your hands down or you're trying to get back in. Councilwoman LaFortune? I think she forgot her hands up. So,
Oh, no, I'm sorry. That's my mistake.
Okay,
Sorry.
all right. All right. Okay, then Leader Ryan? Are you muted?
That mute button. I just wanted to ask if we could have a communication plan or a plan expressed to us and given to us so that we know what organizations have been tapped into. Director Hawkins just talked about the great effort regarding the homeless population. We don't know those details. And that gets to the point that I was saying, we can't do a gap analysis because we don't know what the plan is. So if we could share that with us, I think that we can all help. And the other thing that I am looking for is I would like to ask tonight for a global, well, I'm going to ask for a global communication strategy, but I'm sure you're going to put that in your plan. But also I want to make sure that you give the council people and everybody else for that matter, a consistent way to register to get a shot when the plan allows for their age group to be called upon. I think that's really, really important. And I don't know what to send out. So I'm going to ask you to follow up and provide that to us. Thank you. All set, Council President. And thank you all.
Thank you. So I know it's been a long night, long meeting. Thank you so much for all the guests that join us. Director Hawkins and your team, Larry Warner, Dr. Rodriguez just sent me a text. He just lost connection right now. He was connected with us. Thank you so much for the time, Teresa, Tracy, and the team at the mayor's office. I just want to repeat what my colleague said. Thank you, Larry, also. I just want to say that we don't want to be adversary. We want to collaborate, but we want to help you. But we cannot help you if we don't know what you're doing. So please, I want to emphasize the need of the communication. And also, I would like to get the data as soon as possible, as soon as available, about who got the vaccine, breakdown by zip code or by neighborhood. Okay. Thank you so much. Thank you all. With that, I have a motion to adjourn.
Motion to adjourn, Madam President.
Second, Madam.
Yeah.
We all
Okay,
second.
We all second. The motion has been made a second. All those in favor?
Aye.
Aye. We are adjourned. Thank you so much. Good